Shafak, let me know when I can kick off and we'll start.
Yeah, I started recording.
Great stuff. It's always a privilege to share time with leaders in the NHS, particularly after the last extraordinary 12 months. But as we move now into winter, despite all the good news around the vaccines, we are facing a challenge again. Warnings from the First Minister in Wales, Mark Drakeford, about potential reintroduction of restrictions if numbers do not decrease, and also pronouncements from various boards about potential hospitals no longer allowing people to visit is the backdrop. The reason for our get-together today is really to follow on from the Langbuisson report. We were privileged to meet so many leaders to share their insights now as we move to hopefully restoring elective surgery and transformation of the NHS. It's always a privilege to bring back people whose insights can add value to anybody. And I'm therefore privileged, Steve Moore, the Chief Executive at Hywel Dda University Health Board, for giving us his time once again. Welcome, Steve.
Thanks. Nice to see you again, Sahar.
I've got to start with obviously where we are in terms of the staffing situation and the shortages, and these are now being felt across all sorts of parts of the economy, health and non-health. We're not going to have time for a long political debate around that, but I really wanted to tease out from you, since the last time we spoke, I mean, the extraordinary journey and innovation, because this will help us to work out. We're not going to be able to solve and increase numbers immediately, but I just want to see what you had done and are doing in terms of using a finite resource to meet sometimes what seems like infinite demand, and particularly your innovation around teams around the patient, because I think that's been a really profound change in the way that you've worked over there.
Yeah, I mean, like you say, it has been a really tough 20 months. Probably our biggest concern through all of this has been how to support staff on the front line. And of course, you'll be aware from our previous interview that Hywel Dda went into this pandemic with some real staffing challenges, as many rural places tend to struggle with. So, I mean, the bare fact of it is, in the moments of particular pressure, and of course we are feeling that very much now, that puts a huge burden on our staff. You do have to stretch your resources, and that's easy to say, but the implications for our staff on the front line are a real continuing worry about the impact that will have both in the short and long term. I mean, we have got some real bright spots. I mean, we've seen throughout the pandemic people running towards us, wanting to help. And we've seen particularly the number of people who wish to be healthcare support workers increase significantly. And of course, we're now looking at ways, as we hopefully start to come out of this pandemic in the spring, of how we can help those who want to start on more formal courses towards registration, for example. But we've also, at the other end of the scale, got many tired staff, many staff who maybe have been thinking about what their future might look like, linked to things like pension reforms and so on. So we've got a real balancing act here to try and ensure that we come out of this both supporting the staff who have been through such a terrible time, but also rebuilding. And we can see there's a lot of different levels to that. As you say, one of the key things is the team around the patient work that's being led by the Director of Nursing. That really came out of our experience of the field hospitals. We were very clear up front. We wanted our field hospitals to be step-down facilities. And that enabled us to build a very different model around supporting those patients who were in there. A much more team-based approach. The domestic workers down there, the people who were preparing the lunches and the dinners, for example, were seen very much as part of a wider team. And every morning there was a sort of group huddle, and the whole team were there to support patients. So some of our support staff were doing things that in wards they don't tend to do, because they're going from one ward to the next and don't create that kind of that relationship. So we're really determined to try and take that model, our sort of NVIS model, as we're calling it, back into the hospital setting to see whether we can really learn some of the benefits from that field hospital experience. And we're starting to see some early indications that that's working. It is much tougher to do, I would say, though, in an acute hospital setting, which is very busy, with lots of staff having to do lots of other things. So yeah, early days on that, but I feel that is one of our positive legacies that we want to build on coming out of this.
Thank you, and we'll no doubt revisit with you again, and it'll be interesting to see how that has translated into an acute setting, because as numbers need to grow over the years, any of those type of innovations and deployment of staff, as you say, is going to be important. I'm naturally going to lead into the well-being issue, because you touched upon it, and I think you tweeted recently, you know, that it's tough out there and we've got to look for red flags. Whilst it's wonderful and absolutely right to see the support, the NHS people running towards the NHS, slightly disturbingly seeing increases in you know, acts of violence against the NHS staff in Wales, which is perhaps part of a broader thing. But looking at the well-being, I know the whole pandemic led you to look at your strategy again, healthier Mid and West Wales, I think, you know, reprioritising things. But I was interested in particular your initiatives around some of the nature-based well-being initiatives, the peer group and psychoeducational support. You know, there's been lots of innovation. I know it was set out by the Health Circular a long time ago, but just to give some flavour, because I know you've been very close to that and you're very passionate about it.
Yeah, and we're really passionate because we're in the process of designing a new hospital about how we can do this in a more sustained way in a new build. But with our 4 existing hospitals and also with all of our community facilities, during the pandemic, particularly in those very difficult moments, staff reporting back to us just how important it was to get time out, particularly in touch with nature, but also things like we put in kutch rooms, as we called them, so people had somewhere to go that, you know, didn't have notice boards. They were places where you could go and just get away from work for a minute and reflect and have time to process what were some really quite difficult moments for staff. So really led by our workforce team and our psychological support service, over the summer of last year, we really focused a lot on creating better green spaces around our hospitals, planting trees, all sorts of individual initiatives according to the benefits on the site. And we got so much positive feedback from staff, just somewhere you could go in your lunch break, if you were able to get one, to just unwind and just to reflect a bit. And we want to take that forward. We're seeing our sort of mission to be very much to design our facilities now very biophilically. To my knowledge, there's only one hospital in the world that's been built biophilically from the ground up, and I think that's in Singapore. But we want to learn those sort of lessons, because actually it's good. We know it's good for patients. It's good for their recovery to have sort of more natural surroundings than maybe our clinical surroundings tend to offer. But the pandemic's shown us just how beneficial it is for staff too. So we want to make sure that we really build on that coming out the other side of this.
No, thank you for that. And I think with the emphasis on nature and sustainability at the forefront of everything as we are speaking today, that's a wonderful initiative, and I'm really looking forward to hearing a bit more about that in due course. I know that you're a passionate advocate in terms of increasing productivity. I mean, you've got a background in obviously rural settings for 30 years, private settings, and clearly productivity is going to be informed by technology, and there's no magic bullet. I've seen obviously the remarkable transformation. I think it was pre-pandemic, you had about 1% of outpatient appointments online. I think that skyrocketed to 28% beginning of this year. It's probably higher now, I don't know. But I wanted to look at a bit broader, because some of the initiatives that are interesting, your TriTech Institute, which I think you're in partnership with Swansea University, that's quite a visionary step in terms of looking for the ideas or the next thing to change social and healthcare. So just wanted to expand. I think some winners have been introduced, but it's not well known outside perhaps Wales. But I'd be intrigued because it's fascinating to read about it.
Yeah, I mean, if I just started a bit about general productivity, I think productivity's got a bad name in the NHS because I think it's felt to be making everybody work harder and faster. Actually, for me, it's all about how do we make the lives, particularly of our frontline staff, easier, give them the tools that enable them to do the things that they've really been trained to do and they want to do, which is care for patients, without all of the other things taking away from their time. And again, we found some really great innovations through the pandemic. You mentioned the sort of whole shift to digital, and clearly that's a big story across the NHS. But also we brought in things like family liaison officers, much more sort of hospitality-based people who were able to keep family in touch with their loved ones, which of course was so important when visiting was difficult. But they took a huge amount of burden off our frontline health staff, and we're keeping them because actually in terms of productivity of what we do, they've added to that significantly. And there's a number of other things like that. Of course, you mentioned TriTech, and that was really an innovation which came directly from our clinical engineering department. We've got a fantastic clinical engineering department down here, but it's linked very much to our strong desire coming out of this pandemic to leverage what can be termed as our sort of our anchor status, our foundational economy responsibility. But we've seen this pandemic really hit our communities quite hard, particularly our most vulnerable, most deprived communities the most. And this initiative, whilst it was sort of starting in the background even before the pandemic, has really demonstrated how best the public sector can work with the private sector. So rather than us sitting here and trying to pick, say, winners from local businesses, which can be fraught with all sorts of dangers, and procurement rules are not easy to get through either, particularly if you're a small business. TriTech is essentially an offer to local businesses who may be designing things like medical technology to say, well, bring it in, we'll assess it for you, we'll get our clinical engineers to look at it, to look at the practicalities, to give you feedback, and also we'll try it in the real world for you. And that enables them then to improve their product, to get it properly accredited and kite marked, and not only supply it to the NHS, but I hope, to sort of be able to export it into the rest of the UK and maybe wider. And that really leverages what we can do alongside the private sector to bring great jobs to West Wales.
No, thank you for that. And I think, as you say, that reference to anchor role for NHS institutions, that's really bringing it to life. As you say, small businesses with good ideas through the Byzantine procurement rules. I mean, sometimes they just can't get those things started. So, and this, of course, ultimately will have an effect over the medium term, or if not earlier, on staffing numbers, workforce planning, etc. If it improves patient outcomes, if it allows time to be devoted to clinical delivery, etc. I'm just going to do a segue before I do to the final question. As of course here in England, we are looking at a quite profound transformation from a statutory basis with the integrated care services and boards and etc. And that's going to be interesting because integration has been on the agenda, as far as I can certainly remember, for a couple of decades, and probably a bit before that. I'm not going to ask you to comment about what's going on in England, obviously, but I'm well aware of the work that you do in your geography, which is rural, and just be interested to get some of your learnings and feedback about how integration on the ground directly helps the acute setting, because I know that you work extraordinarily closely, of course, with social care and the community provision.
Yeah, and of course, one of the reasons I came to Wales is because the level of integration, at least in NHS terms, was far greater than it was back then, which was a few years ago now. And seeing the attractions of that and seeing what we could do with a system where effectively a single organisation was responsible for hospital care, community care, the commissioning of primary care, mental health, public health. Really interesting. My first sort of foray into it when I first arrived, I was really surprised at how a system which looks integrated can still be somewhat disintegrated. And actually, it's taken a fair amount of time for us to get to the point now where it feels, at least between our hospital-based services, our secondary care services and our primary care services, much more joined up. And I think we have got there. And in some ways, the pandemic accelerated that to a degree as well. But that system for me is full of opportunity. It allows us to look at a whole shift of care in a way which is so much easier because we've got all the levers from our secondary care into primary care, and we're working on that, and we're working on that actively now. And our board assurance framework, which we've just redeveloped, is really starting to measure all of the things that you'd expect to happen with a shift from secondary into primary care, not just the money element of things. But I think you're right also, the relationships between health and social care are much closer in Wales, very close in West Wales. We've spent a lot of time during the pandemic, almost on a weekly basis, talking to the leaders and chief execs of the 3 local authorities in my area. And I think that's created a level of trust between us, which whilst we were in a good position before the pandemic, has really blossomed in that time. And of course, one of the biggest challenges we face at the moment is the impact of a number of things, including the pandemic, on domiciliary care. So the ability to get people back into their own homes with care packages, it's been really pronounced in the last 6 to 12 months or so. Because of the level of trust we have with local authorities, actually we're working on a fairly significant extension to a bridging scheme that we had previously, which normally supported people for some days or maybe up to 2 weeks. We're now looking at doing that for up to potentially 6 months and employing staff ourselves. I don't think that would have been possible without the level of trust we've got with our local authority colleagues. There are clearly worries with that, and we are continuing to work that through, both short-term worries about effectively all fishing in the same pool for staff, but also longer-term worries about sustainability. But their willingness to work alongside us gives me real optimism that we'll come out, I hope, with a domiciliary care system at the end of this, which is much more sustainable than it has been for many years down in West Wales. I think that's a real demonstration of the level of joint working between us and our local authority colleagues.
No, thank you for that, and I think it's inspiring. Someone who's had a family interest in social care and domiciliary care for many years to see that type of initiative, and I think the two big takeaways for me for England would be the fact that it's possible. So that's the first thing we need to think about, despite all the statutory hurdles that may be melted away over the next few months. But as I think the big thing there, the word that resonates is trust. And leadership and the importance of trust actually has been a feature of a Harvard Business Review article over the course of the pandemic, just showing how important. It's a word that gets bandied around a lot, but it requires a tremendous amount of hard work to establish it. So thank you for that. One final question to wrap up, and it's really looking at the question of sustainability and bringing this all together. I mean, I think you joined Hywel Dda at the same year as the Wellbeing of Future Generation Wales Act came out. I think it was 2015, if my memory is correct. Now that puts into it's a very visionary piece of legislation with a number of areas that it focuses on, but which we don't have time to go over at all, except for obviously workforce planning is one of them, and it emphasises that. And now you've said obviously you've had to maximise your use of temporary workers over the course of the pandemic. We're going into a period where demand is at record levels, and you're clearly going to need to use temporary, agency, bank, the full panoply of the workforce. How do you see that happening, and can it be done in a financially sustainable and operationally sustainable way? Big question. Sorry about that, but
no, and we've had a very significant reliance on agency for many years in West Wales, which it has been a concern for us. So I think the answer to your question, firstly, you're right. The legislative framework around wellbeing of future generations is unique. It does give us. It requires us to think differently about what we're doing today in relation to the future, and I think we've still got a way to go in really grasping that and understanding what we can do. But the ambition overall for us is to get to the point where we have a sustainable local workforce supporting the NHS, not just because it's good for the NHS, but we know it's also good for our communities. These are good jobs, they have good prospects, they can break cycles of poverty. Our challenge has always been, how do we get particularly young kids from those communities onto the right kind of escalator to get them into the NHS and get them into the education that they need. We have got, I think, just the most fantastic workforce department who have been running an amazing apprenticeship scheme down in West Wales for many years. So what we do essentially with that is we ask people to come forward for these sorts of jobs with no concern about their initial qualifications. We're looking for their values, we're looking for who they are as a person, and the deal is they get on board with us, and in doing so we'll train them, we'll get them through university qualifications, we'll support them in doing that in a way they would never have been able to do before. I mean, to get a sense of the scale of opportunity, we've been ramping up every year, even despite the pandemic. We had 60 places last year for apprentices, and we had 600 applications in West Wales. Wow. So, you know, a real appetite out there. So we're challenging ourselves about how can we grow it faster and bigger, because we can see we can get this this to work. We've got some really important things happening. So in Mid Wales, where one of our hospitals in Aberystwyth, Bronglais Hospital, has been challenged probably the most with lack of staffing. It's great to see that the university there in Aberystwyth is going to start nurse training from September. Again, I think that's going to be a massive step forward for us. It'll take years to be felt, but a significant structural change which will benefit both our hospitals and our local communities. And we think all of that, so growing our own, supporting our current staff, reducing trying to increase our retention rates so that people stay despite what they've been through, which is all about that workforce wellbeing stuff we talked about earlier, and encouraging kids who might not have got the right qualifications to come, and we'll support them. All of that, I think, is going to add up to a much more sustainable workforce model for us, and actually a great impact on our public health in West Wales as well. So I'm really positive about the future, and as I've said many times in public and private forums, I think we have a moral responsibility as leaders coming out of what has been an awful 2 years to build a positive legacy out of everybody's experience, and I feel that every day in all of our work.
No, and thank you for sharing. As you said, the legislative framework is unique, and to think differently is probably something that we all need to do, and to build a legacy, as you said, in the apprenticeship numbers and enthusiasm and appetite, and particularly for me, as you say, it's a route perhaps of breaking cycles of poverty, and there is, frankly, that's invaluable. There's no budget price on that. So as always, it's an inspiring time to listen to your insights and to hear these practical examples. And I'm going to wish you a good winter, personally and professionally, and I hope we'll have a chance to meet in person again, perhaps when spring is back with us. Yeah,
that'll be lovely, Sahal. Thanks very much.
My pleasure, and thank you so much for giving us your time for this future-proofing of the NHS Workforce Leadership Series.
Thank you. Thanks. See you soon.
Take care. Thank you very much, Steve.